So
You know,
these are
you haven't
these are
really,
very common discussions
yeah,
in our
they
team.
are. And I think it's, it really begs the question because in DB09, the CR rate in patients getting first line T-DXd with pertuzumab as opposed to kind of a CLEOPATRA regimen was double. You had
Yeah.
the 15% of patients had a CR. So, not all of those were oligometastatic, but if you have a patient that you're giving your first line therapy to and they suddenly have a CR, you really are going to think about, what's going to happen to this patient. And so I do think, some good response obviously is needed in all the trials that looked at oligometastatic strategies. You did require some response to begin with, but we're going to see the response in these patients. And then this question is going to come up.
Well, and
Uh,
to your point, Allie, with
yeah.
that patient, once you have a great response to first line TDXD, if that's what you're given and you have a complete response and you're thinking about treating, I don't know, scar tissue in the bone that remains or something,